a difficult thing to treat.
Yeah.
Yeah.
Well, it makes me think of the conversation we had about kind of moments in gray areas with clients with chronic pain. It's like here you have someone in chronic pain and they've been in pain for a long time. And how do you sell them on, long-term recovery as a result, when they're just in pain? And there's a lot of gray area in that. But, some of these recommendations that you're
Yeah.
touching on too is like there are alternatives. And the biggest part, I would say, like with recovery is that, you really shouldn't have to be sold on it or it's not going to stick. And, it's got to be a willingness to work on some of these things and take the recommendations from the
Yeah.
professionals.
We we have a hard time treating, not only because the chronic pain is affecting and using opiates, the brain's ability to recognize that that can be a form of an addiction and that they may or may not want to come off it, but we've kind of created this monster where we're feeding it. And, like I said, I really try to not do that. Some instances where I do would be, like an acute back strain. Someone gets injured while they're under my care, and I know it's going to be short term. So they may get something very low dose for just the shortest amount of time. And if it persists beyond that, then I start looking at other things and getting specialists involved. Or some of our veterans, they've been homeless. They get all their teeth pulled, every single one, and so they're in a lot of pain. And I'll do something short term for that as well, so that they can feel comfortable eating and doing their daily activities. But we have a lot of guys that are in recovery, and they'll go through things like that, and they say, I don't want anything at all, because they know that they're more prone to using and abusing and misusing those things. So
Yeah. Meth will do that to you, huh?
yeah.
Yeah.